This just in, the CDC is updating its recommendations for COVID-19 booster shots, saying every adult should get the booster. That comes as Omicron is causing global concerns, and with it, some restrictions on international traveling, including into the U.S. for non-citizens. Effective today, the Biden administration has restricted travel from South Africa and 7 other countries in southern Africa. Today, President Biden called Omicron a cause for concern, but not a cause for panic. In a news conference, he said he was not considering any widespread U.S. lockdown. He urged Americans once again to get fully vaccinated, including booster shots, and to wear masks indoors in public settings. Scientists are racing to figure out how risky Omicron is and whether it can evade vaccines. We're joined now by Dr. Thomas Fekete. He is a professor of medicine at the Katz School of Medicine at Temple University with a focus on microbiology and immunology. Doctor, first and foremost, what is it about Omicron that has some scientists worried?
There are several different variants, as we've heard about now over the last year and a half, and the one you know probably best is Delta, which is the one that sort of swept the country. Omicron is new to us, and it has some interesting features that make us potentially concerned. That includes a number of mutations, more than we've seen in previous variants. That makes it hard to know whether it might be more contagious or more severe, and whether it might supplant the current coronaviruses and cause a larger epidemic.
So, as we mentioned, the U.S. is instituting travel bans on non-citizens from only 8 southern African nations. Meanwhile, Omicron has been found in the U.K., Israel, Australia, Belgium, and Canada. It feels like this narrow ban will not work. Should there be a travel ban on all countries like Japan and Israel have instituted?
Gosh, you know, you're putting the doctor into the position of a diplomat, which I don't necessarily have expertise.
Not my intent.
No, it's okay. I don't think we know if travel bans work. I think we believe at best they may delay the problem a little bit. The travel bans are tricky, as you said. The cat's out of the bag in many countries already, so a travel ban now might not be very effective. I think it's a good question to ask. I don't think we have a good answer.
And Doctor, what advice do you have for our viewers to try and be vigilant against this and eventually other variants?
Well, as stated earlier, I think the best thing you can do is to get your vaccination, including your booster. That seems to be a pretty protective thing to do, and it certainly seems to make the likelihood of infection lower and the severity of infection lower as well. The second thing you can do is use your common sense and be cautious when you're in public spaces. Wear a mask whenever you feel that's appropriate, perhaps maybe more than you feel is appropriate. And I think that social distancing is reasonable, although it's very difficult to maintain. So the common sense things, of course, it's always good to practice good hand hygiene and avoid other infections as well as flu. So be smart, be sensible, and take care of yourself.
Yeah, I feel like we all want to get back to February 2020, but this pandemic is not over. Dr. Thomas Fekete, thank you very much for joining us today. We appreciate it.
My pleasure. Thank you.
Natasha.